the thought of this actually becoming a possibility was so exciting, I think, to veterinarians and veterinary teams, but also to pet parents.
What is the OncoK9 early detection cancer test? What cancers does it screen for, and what can be done when results reveal a positive cancer signal detected? Find out on this episode of Tripawd Talk Radio.
Man scratching like a three-legged dog.
For any tripod, cat or dog.
Why do some vets do things that way? Why?
So many people don't realize that their dogs are in pain.
He's a three-legged dog and he's still pretty good.
Hello, and thanks again for tuning in to Tripawd Talk Radio. This is episode number 115, and we're going to be discussing promising advancements in the detection of canine cancer. Nearly half of all dogs get diagnosed with some form of cancer. Wouldn't it be great to have an accurate early cancer detection test for your dog? And what can you do if a cancer signal is detected? Well, we're about to find out. Keep listening as Rene talks with board-certified veterinary oncologist Dr. Andi Flory, Chief Medical Officer and co-founder at PetDX, creators of the OncoK9 Early Detection Cancer Test.
All right. Well, Dr. Flory, we are so excited to have you here today. We have a lot to talk about, and let's just jump right into it. Can you tell us how and why you got involved with OncoK9? What's the company story? Because I'm just starting to hear a lot about it these days.
Thanks so much for having me here. It's really great to be here and to talk about OncoK9. So my involvement was that I am a veterinarian. I'm a medical oncologist, so I treat cancer in dogs and cats. And I have practiced here in the San Diego area, which is where I live, for a little over a decade. And in 2019, I was practicing here. I was working at both of our hospitals that are in this area. And I kind of think of it a little bit as fate kind of made this all happen, because I was really interested in early cancer detection and what pet parents could do to try to find cancer early. It's one of the most common questions that I get is what could I have done? What can I do for my next dog, to try, if they're going to develop cancer, to try to find it early. So I was sort of already thinking a lot about early cancer detection. And I happened to have a little patient by the name of Poppy. And so Poppy came to me, and like most dogs that I see in clinical practice, unfortunately, her cancer was detected only after it had spread. And that happens, unfortunately, not infrequently, because the way that we usually find cancer in dogs is that they start to show clinical signs or symptoms, is what they would be called in people. In dogs, we call them clinical signs because they can't voice them. They can't tell us that they're nauseous, but we can see that they're nauseous because of the signs that they're showing. So she, because her cancer was detected because of clinical signs, her cancer was already advanced, and it had already spread. And as a veterinarian, having to tell a family, I'm sorry that, you're going through this diagnosis, and there are definitely things that I can offer. I can do things to help Poppy feel as comfortable as possible for as long as possible. And here are the options that we have. But in terms of a cure, the chance of that, unfortunately, is low. It's kind of a devastating feeling. Well, as we were going through Poppy's treatment, I got to know her family pretty well. And it turned out that Poppy's owner, her dad, is an MD by training, but his background expertise is in something called genomics, which is basically the study of the entire genome, or the set of instructions in the DNA, and also something called liquid biopsy, which is cancer detection with just a blood test. And so he said to me, sort of as we were going through her treatment, this is my background and my expertise, and going through this with Poppy has really made me realize that if we only could have found it sooner, we would have more options. Do you think that cancer detection with the blood test is something that veterinarians could use in the management of their patients. And I think my jaw just dropped. It's like, wow, imagine all of the uses that we could, that we could apply if we had a blood-based, non-invasive test like that. And so it was a resounding yes from me. And so we co-founded the company in 2019 and with a small team of us. And now we're super proud to have developed a really fantastic test called OncoK9.
It sounds like Poppy was meant to come to you and to bring this out to the public. Talk about the stars aligning. I mean, cancer is an awful thing, but gosh, for you to connect with her dad and then start this company, it's so exciting. And I've been hearing about it on the human side and not as much on the veterinary side, because like you said, it's pretty new. When did the test become available? How long did it actually take you to get from the point where you first decided to partner and then bring it to market?
Yeah, so we started that in 2019, and we realized that really the first step was that we needed to develop the test for dogs, and then also demonstrate how well it works in dogs with and without cancer. And so we actually started our trials later that same year in the fall of 2019.
Wow.
And we were able to enroll so many dogs because I think that veterinarians have heard for so long, isn't there a blood test for cancer? And we've always had to say, no, that's, the response is kind of like, no, that's not possible, or, that doesn't exist yet. Or the thought of this actually becoming a possibility was so exciting, I think, to veterinarians and veterinary teams, but also to pet parents. There are so many pet parents out there that have had a personal connection with cancer. They've had a pet with cancer. They've had a loved one with cancer. They've had cancer themselves, that they know that this is a big problem, and they wanted to kind of pay it forward for future dogs with cancer. And so there was so much enthusiasm that we actually enrolled well over 1,000 dogs into the studies at 41 clinical sites around the world. And so we were able to perform a very large clinical validation study using 1,100 dogs with and without cancer, which is just phenomenal in terms of those numbers. Those aren't numbers that we typically see in veterinary studies. And so the test actually then became available in the spring of 2021.
That is quick. that is, I mean, you hear about, clinical trials and things going through the FDA and for approval, and they take years and years and years. And it's so exciting that this happened so quickly. I know if I had known that you guys were looking for somebody to volunteer their dog, I would have raised my hand to be part of this. This is so exciting. Now, you had mentioned earlier liquid biopsy, and that is something we should probably discuss before we move any further. Can you tell me what exactly that means?
Yeah, liquid biopsy is basically the sampling and analysis of biomarkers in a fluid in the body. And so a biomarker is essentially something that we can find that indicates the presence of disease. And in this case, we're talking about cancer. And then fluids that are normally present in the body, the one that we most often think about is blood, but there's other fluids in the body like urine. There's fluid around your central nervous system. So that's called your cerebrospinal fluid, or CSF. And sometimes in disease, there's fluids in the chest cavity or in the abdominal cavity if there's a disease going on. But the most prevalent and the fluid that is really the most reliable in terms of looking for a biomarker is really the blood. So when we talk about liquid biopsy for cancer, we're generally talking about using a blood sample, which is, easy to get. It's straightforward. It's something that your pet probably has once or twice a year already, especially as they get older, is typically have a blood sample drawn. So this is a test that's essentially done using a pretty standard routine that's performed in the veterinary practice, which is a blood draw.
And regular veterinarians can do this. They don't have to be a specialist.
That's right. Yeah, that's definitely an important point. So because it's a blood draw, which is something that any veterinarian does, this is a test that can be performed at any veterinary clinic. They do need to have a special kit to be able to do the test because it requires some fancy blood collection tubes that stabilize the DNA. Because really what we're looking for is these tiny, tiny little fragments or bits of DNA that come from cancer cells. And so these tubes stabilize the little fragments of DNA that are in the blood. And then they basically pull the sample using that kit and then send the sample back to our lab.
Wow, it sounds like sci-fi, and it's so awesome that it's real. This is so cool. Now, what cancers does the test screen for?
So the test is a multi-cancer early detection, or MCED test. So this is a multi-cancer test. It can detect 30 types of cancer, including the most common cancers that we see in clinical practice. So if we think about those most common cancers, there are about 8 of those that veterinarians see the most frequently in terms of what they're seeing their patients be diagnosed with or that they're managing. And in those top 8, the detection rate of the test is 62%. And in kind of the big 3, I like to call it, which are the most aggressive cancers that we see in dogs, which are lymphoma, hemangiosarcoma, and osteosarcoma, the detection rate is 85%. So really, really phenomenal in these really aggressive types of cancer.
85%. So my dog had osteosarcoma, and we didn't know it until, even after he started limping. It was assumed that he had pulled something, or, oh, it's a cruciate tear, or this, that. But basically it took months before we and the vet knew what was happening. This test could detect osteosarcoma even before all of that, before the limping and the obvious outward signs.
That's exactly right. So, that's really the hope, is that this is a test that can detect more cases of cancer even prior to the onset of those clinical signs, really, because that means that if we can detect it earlier, we generally are going to have more options for treatment. Our dogs are starting from a place where they feel better, so they're usually going to be kind of more resilient for any of those treatment options that we decide we want to choose from. And most of the time, they're going to have better outcomes in terms of, if we're starting from a place before they have clinical signs and symptoms, then they're usually going to have better outcomes in response to treatment.
That makes total sense, because if you are just feeling good and you get this news that you may have something wrong with you, you're going to be able to bounce back mentally and physically a lot sooner from any kind of treatment. Now,
I want to just sorry to interrupt, but I want to just address one other thing that you kind of mentioned, which is, could this, in a situation like, unfortunately, I'm so sorry that you went through with your dog, which is where we have this long period of time where we don't really know what's going on until we get that diagnosis. This is a test that can help in a couple of ways. One is that it can be used in dogs that don't have clinical signs yet. So it can be used as a screening test to look for cancer in an asymptomatic individual, but an individual that's at higher risk because of their age or because of their breed. But it also can be used as an aid in diagnosis. So when we start to have that limping that's not responding to treatment or, seems unusual, this can sort of help to say, well, cancer is on the differential list for a lot of dogs that have limping, unfortunately. Is cancer maybe the cause? And this is a non-invasive test that could tell us whether what we're looking for is a cancer signal, which is basically those DNA abnormalities. And with this test, the false positive rate is only 1.5%. So it's very, very low. And then that could be an indication that cancer is present, and then we'll kind of maybe shorten the path to diagnosis, because now we're more aware of it and we're kind of looking a little more closely.
Absolutely. Now, I know that once you deal with cancer in a pet, you become hyper vigilant about every little thing with all of your pets afterwards. So any little limp, the first thing that comes to your mind is that. I know that in our community, we've had members whose pets started limping, but because they didn't fall into the breed type for that suspected cancer, the vets never even brought it up, because like we've had Chihuahuas with osteosarcoma, and that's a breed that, wow, they're not supposed to get it.
Right.
So I love that a pet parent, if the veterinarian doesn't bring up this test when discussing what could possibly be wrong with their dog, a pet parent could advocate for this test. Now, I know a lot of people are wondering, we're going to keep talking, but what is the ballpark price range for something like this? Because I know that's on a lot of people's minds right now.
Sure. And it's going to vary depending on probably what part of the country, or, it's available in the USA and Canada. So it's going to vary a little bit depending on where you are. But the average price that we're seeing is around $500.
That's not bad when you consider what people spend on diagnostics.
Yeah. And so exactly, adding it into the diagnostic workup if cancer is suspected, or adding it in as, for example, a yearly screening test. Once dogs are sort of considered at higher risk, this is sort of the recommendation is to do that annual screening.
I would love to see this written into pet insurance coverage, maybe in their wellness plans. I would be willing to pay extra to cover my dog in that area so that she could have a test like that every year, because we adopted an older dog and she's 7 or 8. So, boy, it would be great. Trupanion, if you're listening. So, but let's, okay, North America, Canada, do you have any plans to take it over to Europe or Australia?
So it is exciting news that it's available now in Asia. So, I would say stay tuned. It's certainly it's my hope that we get as many dogs tested as possible, right? That as many dogs as possible get access to the power of this type of technology. So that's the hope.
Yeah, the nice part too is that if you live in an area that doesn't have all of the diagnostic tools, the PET CT scans and all of that stuff that goes and looks for cancers. I mean, could we just jump straight over to this, skip all of that stuff, and let's just take this test and see, just in case. Now, early cancer detection, it's important for people and it's important for pets. How do we do that? How are we as pet parents supposed to detect cancer in our pets, aside from this wonderful test that you guys have developed?
Well, I think that probably a lot of pet owners do this naturally, but I would say the first thing to do is pet your pet. So, that's how you find a lot of things, right? Is that you're constantly petting them, and the second they get a little lump or bump, and that's really important. It's actually a really important step in cancer detection, is you just sort of paying attention to what's happening and changes that they have that you can see and feel, changes that you notice in their habits and how much they're eating and drinking and sleeping and activity level and that sort of thing. And is certainly, if you're noticing any problems, getting your veterinarian to take a look right away. But it's also remembering to do that preventive care, right? The guidelines that we have as dogs age are really important to detect disease early, and they include at least once a year, but typically twice a year as our pets are getting older, to go in for that physical exam, that routine lab work, which looks for so many things. And it's really looking to try to find disease early when it's going to be the most manageable. So it's really, really important to continue those things. And then adding into kind of those wellness visits is now this opportunity to add in liquid biopsy to that annual blood work, is to add on this blood draw for an OncoK9 test.
I mean, if you're going in for the wellness check anyways, you're looking to make sure everything's okay. That test could literally save you so much money later on down the road. Find it early, get it treated early. It's a lifesaver, really, is what it sounds like.
That's the hope, is that, well, by detecting cancer early, we can make an improvement in terms of the ability of families to treat cancer, because they're going to have more options to choose from, that they're going to really have time to do that, to kind of make those decisions. And that ultimately the patients, the pets themselves, will have better outcomes, because we can start from either an earlier stage detection or an earlier clinical detection before they're sick. And both of those can result in improved outcomes.
Yeah. One of the most heartbreaking things we see in our community is the dog will go through an osteosarcoma amputation, and then a few weeks later, their owners are told the dog has lung mets, and really bad lung mets. This happens. It's heartbreaking, at least once a week. So a test like this, what you're saying is that we could even catch things before they progress to lung mets. Is that right?
I mean, it's possible. So the test can detect as early as stage 1, but it's it's that it improves our ability to detect cancer before clinical signs and or earlier stage. So both of those can result in improved outcomes. So the hope is just to give awareness that something's going on, right? We have to know that it's there to be able to make the recommendation to find it, right? To do the workup to find it. So this is sort of a way to add into what our current paradigm is, really our current kind of set of recommendations, so that we can detect more cancer earlier. So that's the hope.
Mm-hmm. Now, who needs to be screened? What dogs do we start when they're puppies, when they're older? How should we start looking at this in terms of making it a part of our pets' regular health screenings?
Yeah, so we know that the risk of cancer increases for a few reasons. One of the most obvious is age, the same as it is in people. As we get older, we have a higher risk for cancer, but it's also breed. So in terms of making a recommendation about who should be screened, we wanted to really perform a study to look at what should the recommendation be. So we took a very large population of dogs, over 3,400 dogs with cancer, to understand at what age do certain breeds develop cancer. And we used that to make a recommendation. And what we found is that the average age of cancer diagnosis for all dogs was around 9 years old. And because we don't want to start screening right when most dogs get cancer, we want to start screening sooner than that. We made a recommendation to start screening 2 years before that sort of peak incidence. So that was starting at the age of 7. So if we think about the recommendation for all dogs, it's really starting that annual screening at the age of 7. However, we know that there are certain breeds of dogs that tend to get cancer at a younger age. Like if you think of some of these giant breed dogs, they certainly can develop cancer younger. We found that boxers actually develop cancer typically from a younger age. So to make a breed-specific recommendation, we performed this study and we looked at the ages at which different breeds developed cancer. And so it was as early as 6 on average. And so if we kind of use that same idea of starting screening sooner than the peak incidence of when they develop cancer, we want to start as early as the age of 4, depending on the breed. So we turned all of this into an online tool that you can use, and you can input your pet's age, breed, and weight. And that will return to you based on your dog's individual characteristics. When should this individual start cancer screening? Because some dogs are, like I said, from as young as 4, and some are older, like start at the age of 7.
That is really cool. So we will put a link to the test in the show notes. I played around with that, and because we have a German Shepherd, I believe hers came back at start screening at, I want to say 8. Was it 8? I think it was 8. But what
It's
about
probably
mixed?
7? Yeah, because most
Probably
dogs
7. Okay.
at 7. Yeah, German Shepherds I think are 7, but it does it does vary by breed, and so that is that's called the Screening Age for Early Detection, or Cancer Safe tool, SAFE, and you can find that at cancersafe.petdx.com.
Great. We will definitely have a link to that. Now, what if you have a mixed breed dog? How does the test account, or the tool account for that?
Great question. So we took that same group of dogs and then we said, okay, so for dogs where there either wasn't enough of that breed or it was a mixed breed dog, then we developed a formula that was based on weight. And so if you have a mixed breed dog, or if you have a breed that wasn't as common in that collection of dogs, then the recommendation will be returned based on when dogs of a similar weight tend to be diagnosed with cancer, because there is a correlation.
Interesting. So weight. Now, what if, how does this is so off topic. I probably shouldn't even ask it, but I'm just curious, when we're talking about weight, how does, like if a dog is overweight, how does that factor into things?
Yeah, unfortunately, it's an area that we would like to investigate. We didn't have, so that's called body condition scoring, or BCS, is basically, are they overconditioned or fat or obese, or are they underconditioned? Are they skinny or really in shape? That's not, those weren't data points that we had for the majority of the dogs in the study. It's certainly an area that we would love to investigate, but for right now, it's just kind of based on overall weight.
Got it. Well, considering that being overweight, I have read and heard that it actually increases the risk of certain cancers in people. Wouldn't that hold the same truth for pets? And if so, then if you have an overweight pet, maybe it's a smart idea to have this test done regardless of their age.
It's a really good point. We know that, for example, obesity can increase the risk of certain cancers in dogs, like mammary cancer. So it certainly is, it is a factor. So there's lots of things that it can increase cancer risk. So it's not just age and breed, but those are kind of the most immediately sort of obvious in terms of thinking about where should we start. But you're absolutely right, that there are other factors that can increase cancer risk as well.
So, Dr. Flory, if somebody does get a positive test result, then what happens?
Yeah. So again, what the test is looking for is it's looking for basically the abnormalities in the DNA that comes from the cancer cells. And so you can kind of think of those like spelling mistakes in the DNA. And we are looking for the presence of those. And we kind of do that by multiple methods. But if we find that, then that's called a cancer signal. So the types of results that a pet would get on this test are either a cancer signal detected or a cancer signal not detected. So a cancer signal detected, a couple of important things that it's important to note about that result, which is that just like any screening test that you or I would have as a person to look for cancer when we're asymptomatic, if you get a positive screening test, it's important to do follow-up testing to find out and confirm what's going on. So similar idea here. If you have a positive result, then the next step is to do diagnostic tests to confirm what the diagnosis is, to basically find out where is this cancer signal coming from. So the way that the veterinarian would do that is to basically look in the places that cancer could most commonly be hiding. If you're starting from a patient that's limping, that becomes a fairly more obvious of where you start, right? You look in the location where the limp is coming from or the lameness is coming from. But if you're starting from a patient that is asymptomatic, this is a dog that doesn't have clinical signs, then we kind of want to do a combination of tests to look for where could this cancer signal be coming from. That includes a thorough sort of interview with you as the pet parent to find out what's going on at home. Is there anything that's changing? Is there anything new? Is there anything that you're noticing in terms of water intake, food intake, energy levels, that sort of thing? Any limping, lameness, anything that could kind of clue us in where to look. If not, then we do a thorough physical exam to kind of look in all of the places, including looking in the mouth and looking at the lymph nodes and all the little kind of nooks and crannies from nose to tail, and then doing some testing. And that includes some lab testing, like doing general blood work, general urine testing to kind of see if there's any clue that any of the organs are not kind of functioning normally. That would kind of hone us in where to look. Imaging tests, so looking in the most common places that Cancer could be hiding inside of the thorax or the chest cavity. So that means looking at the heart and lungs, typically with x-rays, looking in the abdomen or belly, looking at all of those organs in the abdominal cavity, usually with an ultrasound, but maybe starting with x-rays. And then if there's any limping or lameness or any areas of kind of swelling, taking x-rays of those areas. And then if we find anything on any of those tests, taking a sample. So performing usually what's called a fine needle aspirate, where we're just taking some cells out and trying to find out, could this be where the cancer is coming from? And so then that lets us kind of put a name on it. And then that's how we get to the next step, which is identifying what's the diagnosis and then helping the family decide on the treatment options.
Got it. That makes it very clear. So it's another tool in your toolbox to find and diagnose cancer. But a pet parent should expect that if they get a positive result, that there's going to be a little bit more testing involved after that.
That's absolutely right. Yeah. So we don't ever, just like with any screening test, we don't make major decisions based on the result of this test alone. We always take that next step to confirm what the diagnosis is to actually then be able to make those decisions.
Got it. Super, super smart. It's such an exciting thing to have. Thanks for explaining that.
Yeah, absolutely.
Well, I am super, super excited about this and getting the word out to the community because, so much of our relationship with our pet is about learning how to advocate on their behalf because they can't tell us what's wrong. And so we have a tool like this. It feels so empowering to know that it's out there and we don't have to wait until a tragedy like hemangiosarcoma. I can't tell you how many members we've had whose dogs have succumbed to that. And it came as like this huge shock because there's no warning half the time with that cancer. So we really, really appreciate all of the hard work that you have put into this test and the studies for it. Cannot thank you enough for all you do, Dr. Flory.
Oh, thank you so much. It's been great being here. And, I love that your community. I've always said that I've always sent pet owners to, your community and they get so much information. So it's really lovely to be part of it.
Oh, well, thank you. That's a huge compliment when a vet refers anybody to us. So we will continue getting the word out on important things like this.
Well, thank you so much. This was great.
Bye-bye.
Many thanks to Dr. Flory for her time and the wonderful work going on at PetDX. Learn more about the OncoK9 Early Detection Cancer Test and find out how to get your dog tested at PetDX.com.
He's a three-legged dog and he's still pretty good.
Thank you for tuning in. Subscribe to Tripawd Talk Radio for more pet amputation tips from experts and claim your free gift just for listeners at downloads.tripawds.com/podcast.